Yeah. Hi, everyone. You're welcome to our seminar today. I'll hand it over to Madhu to introduce the session.
Hi, everyone. Welcome to the seminar where we have an interesting panel discussion on the impact of COVID pandemic on TB. Before I ask Petra from our TB Center to introduce everyone, I just wanted to make a couple of announcements. Charity has some announcements as well. First announcement is a leadership transition at the TB Center. As of 15th of October, Dick Menzies will take over as a director of the TB Center, as well as the director of the WHO Collaborating Center. We have two centers, but we are actually one center. So we felt that we should consolidate and have one single unified leadership. And I'm happy Dick, as a senior colleague, has agreed to take charge of both the TB Center and WHO Collaborating Center. I'll continue to be supportive and be an associate director of the TB Center. Charity, what announcements do you have?
Oh, yeah. I wanted to, remind us all that our next seminar is on the 13th of November, and Maya and Mercedes will be presenting to us. We also have the Union Conference coming up in the next 2 weeks. So I'll be sending out like a sheet, a Google sheet for you to put in your presentation. So everyone at the TB Center knows who is presenting at what time. And then finally, we'll present. The first session we have today is the community survey, and Petra will walk us through the presenters. But if you can, please stay behind because we have a student, an undergraduate global health scholar that will be presenting to us for like 15 minutes at the very end. So Petra, over to you.
Thank you. Good afternoon, good evening, everyone from around the world. We're really pleased. I'm really pleased to be actually allowed to chair or kind of open this session and introduce all my colleagues that we've been working really hard on a report and findings looking at the impact of COVID. Around May, we realized that COVID was impacting so many people that were affected by TB, and we really needed voices from the front line to give us the immediate impact of the COVID on this local situation. And we brought different groups together to look at the data from the ground, collect information, and to find different perspectives. We talked to people affected by TB, we talked to healthcare workers, we talked to policymakers, we talked to researchers and NGOs. And from all those different voices, we were able to collect a report, have our findings, and put a strong call to action together. So today, I'm actually really pleased that we're not just presenting the global findings, the findings from Kenya and the findings from the US, but that I also have the privilege to present actually the whole group that was working really hard behind the scenes. And this is, for me, I have to say it had been such a great collaboration. It's a unique group of individuals, all with lots of energy and coming from very different perspectives, which made this collaboration very special. When you have a TB survivor bringing in their own ideas while a human rights lawyer is talking from the other end of the table and an advocate has their ideas on what to do with the findings, while the researcher thinks about how we actually need to make sure that all our data are having the right validity. So that combination of work has brought a unique piece of work together. So as I said, we'll be listening to the findings and the call to action, and we're giving an opportunity to the different advocates in also how are they using this report and the findings in the path forward. And I would like to start today allowing Alex Zimmer and Robin Waite. Robin is working as an advocacy campaigns officer at Result Canada. She's also about to defend her thesis as a PhD next week, so she's in the midst of many different tasks. And together with Alex, who has joined the PhD program at McGill this year, they have been working really hard on the findings and the details of the report. So they are going to present to us the global findings and the calls to action right now.
Thank you so much, Petra. Hello, everyone. My name's Robin, and this is
I'm Alex.
We are delighted to be here with you today. So, Alex, you're going to share your screen. As she's doing that, I'm actually just going to share a link in the chat box to a Google Drive that has a Word document for you to look at. It includes some pre-drafted messages for social media, and there's a ton of graphics in there as well. All the information we're presenting here today are graphics in that folder. So if you want to support and take to Twitter to add your voice to our calls to actions during this session, we'd really gratefully appreciate it. All right, and just to echo what Petra said, this project was really special because it brought together 10 different civil society and affected community organizations from around the world to collaborate and pool resources on one critical project. And it's because we came together that we were able to make so much noise. When we launched the findings of this, we had the executive director of the Global Fund respond to our calls to action, the director of the TB program at the World Health Organization, Luchika, the ED of Stop TB Partnership. So by coming together, we were able to get those big wigs on the stage responding to our work. So when you're working, always try and build community. It's really critical to pushing your agenda forward from an advocacy perspective. All right, Alex, over to you.
Okay, so I'm going to talk a bit about the methods. So for this initiative, we designed surveys for 5 stakeholder groups, including persons with TB, healthcare workers, national TB program officers, TB researchers, and TB advocates and civil societies. And so in each survey, it had approximately 10 Likert scale questions on a 7-point scale, as well as open-ended qualitative questions. Our reach was global, targeting people across the world. And for our analysis, we presented data based on the availability of results in each stakeholder group.
And we just want to note that today we're only presenting really high-level key findings and calls to actions. The full report, which I'm sure Petra will share in the chat box soon, has all the specific detailed results by each stakeholder group surveyed and really comprehensive calls to action. So do go check it out for a more comprehensive and in-depth understanding of this piece of work.
Okay, so for one of our first key findings, we saw that COVID-19 has reduced the number of people with TB seeking and receiving care. And according to program and policy officers, there's just been a global decrease in TB notifications. Both TB testing and TB treatment services have decreased significantly in Global Fund implementing countries. And some of the barriers that were highlighted from persons with TB included limited access to transportation and health facilities being shut down.
And this tells us that there is an urgent need for a fully funded recovery plan to get TB responses back on track. COVID-19 has particularly demonstrated the important role that affected communities play in responding to the health crisis. And now is the time for national TB programs to respond by adapting and prioritizing people-centered approaches.
So we also found that COVID has heightened the fear and stigma associated with TB. The pandemic has pushed persons with TB further into poverty and social isolation, both of which increase inequities and impose human rights related barriers to TB services. So non-medical support was lacking, with people with TB citing the need for nutritional and socioeconomic support. Because of the overlapping symptoms between COVID and TB, many people reported feelings of shame. And this was also flagged by TB advocates who reported an increase in misinformation and stigma in relation to TB. Finally, across both Kenya and India, people with TB feared contracting COVID-19 at their health facilities.
So all actors engaged in the fight to end TB need to promote equity and access to financial support, transportation, quality healthcare, and food for all people with TB. And as an immediate action, technical partners should adopt the recommendations from a recently launched report from the Global Coalition of TB Activists called Activating a Human Rights-Based TB Response. I'll actually try and find the link to that report so that if it's of interest, you can go and take a peek at that as well.
So many health facilities around the world just lack the resources to deal with the simultaneous COVID-19 and TB epidemics. Health resources are being diverted away from TB towards the COVID response. Healthcare workers are lacking essential PPE to care for both people with TB and COVID-19 patients. In the US, over 1/3 of healthcare workers, and in Global Fund implementing countries, over 2/3 of healthcare workers reported that there's just not enough PPE. And in addition to PPE, essential TB medicines are experiencing stockouts and delays around the world. And this lack of resources is felt across both public and private healthcare settings.
So this is no surprise to anyone, I'm sure. COVID-19 has weakened as well as shone a massive spotlight on the chronic weaknesses in health systems everywhere. Healthcare workers are contending with unsafe working conditions, and this is totally unacceptable. Governments must invest to strengthen health systems, and we must get better at using resources wisely by delivering care in an integrated way. In the context of TB and COVID-19, this means implementing simultaneous screening and diagnostic services as and where it makes good sense.
So TB programs and research have been interrupted because of COVID. Healthcare workers have reported a decrease in TB services. A majority of policy and program officers have been reassigned from TB to respond to COVID. TB researchers are unable to travel for TB research purposes, and they have experienced delays in their research, both in terms of human-based research and lab-based research. And finally, advocates from Global Fund implementing countries just expressed an overall frustration with the amount of political diversion and how COVID has just dominated the media in recent times.
So we know that the funding gap for TB is being amplified by the pandemic. So to protect people and past investments, donors need to fully fund the Global Fund's COVID-19 recovery mechanism, which, by the way, here in Canada, we're advocating strongly for our government to invest in that new mechanism right now to mitigate the impact of COVID on TB programs itself, and also to respond directly to COVID-19. And we have also all been really starkly reminded, I think, about the importance of investments in research and development right now. And donors should and can leverage the public's renewed understanding of global health security to close the TB R&D funding gap. And there's product development partnerships that exist out there and are ready to absorb and disperse funds. They include the likes of TB Alliance and FIND, which stands for the Foundation for Innovative New Diagnostics.
So as our attention gets diverted towards COVID, so does our money. Advocates and national TB program officers from Global Fund implementing countries both commented on the diversion of funds from TB towards COVID-19. Advocates also remarked that donor support for TB has just decreased since the beginning of the pandemic. And all stakeholder groups called for additional funding and resources to combat both COVID and TB simultaneously.
And I just realized that the last call to action I made was for this one and not the last slide. So sorry about that, everyone. It happens in real life. So I guess I'll just go back to the other one and just, if you go back 2 slides, because I already talked about the funding gap. Sorry about that, Alex. The call to action associated with building capacity is really about looking at how we've seen the COVIDization of everything from research, politics, the media, the health sector. Everyone's paying attention to COVID. And this has resulted in a lot of essential health services grinding to a halt. But we know that robbing Peter to pay Paul never solves anything. So really what we need to focus on right now is making sure that any interruptions to TB programs are immediately addressed, and building capacity and resiliency in health systems, which, as we've seen, is really critical from the community perspective. So investing in community-led monitoring, investing in community-based responses to TB is critical to build resiliency in those health systems. Sorry about that, everyone. A little nervous.
So despite all these challenges, the groups identified certain opportunities to strengthen the TB response during the COVID-19 pandemic, such as leveraging and using COVID-19 contact tracing and diagnostic resources for TB, the fact that there's an overall increased public awareness of infectious respiratory diseases and how we should protect ourselves, and the successful use of innovative solutions in telemedicine and digital health. So a majority of researchers actually said that their COVID-19 research could be repurposed or leveraged for TB. And finally, all groups just emphasized that investments in people-centered measures in the fight against TB should be sustained beyond the COVID-19 pandemic.
So there is hope. There are solutions out there, and now is the time to really shake things up and get creative. For example, we can and we should leverage investments in COVID-19 for TB, such as any investments in scaling up case detection or diagnostic infrastructure for COVID-19 that can also be used to strengthen the TB response. We've also seen that there's a very strong case for digital health solutions and community-led responses to be rapidly adopted right now, and funding mechanisms like TB Reach and the Challenge Facility for Civil Society, they're ready and waiting to absorb funds so that they can hit the ground running.
So that's all we are going to highlight in this presentation. As Robin mentioned at the beginning, the full report has just way more details in terms of calls to actions and key findings. So I think Petra linked it in the chat, so you should have access to the full report from there.
Yeah, and we really want you to add your voice to these calls to actions. This work doesn't stop here. This was really about getting the evidence base together so that we could then go out as a global community and advocate for the changes that need to be made to mitigate the impact of COVID-19 on people with TB. So for example, we're using these findings right now to feed into the Global Fund strategy development process. In the Canadian country context, I'm using these findings with Results Canada to push for more funding of mechanisms like TB Reach, TB Alliance, the COVID-19 funding mechanism response within the Global Fund. So this is just the beginning. So please do add your voice. You can do that really quickly and easily by taking to social media now, but reach out to us if you want to take some more substantive action alongside us.
Thank you, Robin. Thank you, Alex. That was great. I think that was a really good overview of the overall findings of the report and the main call to actions, really energetically delivered. And I would like to ask Rahab Mwaniki to talk to us now. We had enough findings from Kenya to actually look into data specifically for Kenya, especially interesting that we got a lot of people affected by TB who were rallied to respond. And so we had data enough to give us a good overview. I would like to everyone to please use the chat function for now for questions. We will be asking afterwards one more presentation, and then we'll take some questions in the from the floor, but for now, just put your questions in the chat and we'll pick them up later, okay? Rahab, can I please hear you, you speak?
Thank you, Petra. And good morning, good afternoon, and good evening, everyone. So I just want to add a little bit to what my colleagues Robin and Alex have spoken about, but specifically I want to talk about Kenya and what we got from the study. And one of the things is that we got 50% of people with TB in Kenya reported having trouble finding transport to care facilities. We need to recognize that Kenya and Africa as a large, that there's no structured way of transport. Some places, because of being arid areas, TB patients have to really walk a big distance to the health facilities. And during COVID now, this was even affected more due to the fact that the capacity for public transport was reduced by half, and therefore the fares and prices went up for one-way and two-way movement. The other finding was that more than 50% of people with TB in Kenya reported fear of contracting COVID-19 at a health facility. You may recall that WHO had also said that COVID-19 is airborne and people want and really to keep out of health facilities. 70% of people with TB in Kenya reported not receiving enough support during pandemic, including nutritional and socioeconomic support. We have the Ministry of Labor and Social Protection, which caters for elderly, orphans and vulnerable population, but TB patients are not considered as vulnerable population according to that specific ministry. And this then gives them a challenge in terms of completion of treatment and getting proper, like higher success rates for treatment outcomes. And we even had a case in point where a suspected COVID-19 patient turned negative after testing, but was not tested for TB. And it was not one case, it was not two cases. And this was a missed opportunity in terms of looking for the TB cases among the community. We also had one response that said that more than 50% said they felt shame because of the similar symptoms of TB and COVID-19. And this also led to people not accessing health facilities, health services. A majority of program officers had said healthcare facilities were reducing TB services during the pandemic. They also reported being reassigned to responding to COVID-19 critical gaps, needs, and opportunities in TB programming and funds resulting from the COVID-19 response. One of the strategy, the ministry developed a guideline was that TB patients, instead of taking treatment for 2 weeks, they were allowed to take treatment for a month because now of the challenges of transport, the lockdown, we had very few hours to move from one point to another. And no, because of fear, many people don't access services where they live. They prefer going to far areas because of issues of stigma. One call to action we are asking government of Kenya is to adapt the national TB plans to COVID-19 and implement recovery plans with secure funding to get TB responses back on track to reach the UNHLM targets, the NTB strategy, and the global plan to NTB of 2018-2022, strategies and tactics that advocates can use to influence policymakers in donor and implementing countries as well as stakeholders. The government of Kenya should encourage the participation of parliamentarians, which is very key in readjusting budgets and approving budgets. But also we are also calling on the government to involve civil societies, affected communities, and technical partners in this process. The second call to action is that government of Kenya should strengthen the social protection system. As I said, we have a social protection, but apart from Global Fund, which supports multi-drug resistant TB patient with $60 a month, the other TB patients don't get any support unless you're bedridden and you are at the health facility. So the social protection system needs to be strengthened at the country level to ensure that TB patients also get the support that they need to complete their treatment. The government of Kenya should strengthen patient-centered healthcare systems where people with TB can seek care, and to ensure health facilities can provide quality TB care through providers within the universal healthcare framework across all government levels, mobilizing both the public and private health sectors, including community-based groups. You may already have read that government of Kenya has prioritized the Big Four agenda, which is which UHC, Universal Healthcare, is one of it. And this is an effort to drive economic development. And we are saying if people are sick, if people are bedridden, they don't have the energy to do work, the economy of the country cannot move forward. The government of Kenya should leverage its domestic investment in COVID-19 to address TB targets, commitments, and needs, and all stakeholders, including parliamentarians, civil society, and technical partners, should support national and global fundraising efforts. I'm noting that Kenya government has gotten substantive amount of loans and grants from various partners, from the World Bank, from Japan government, and many, many other countries for COVID-19. But we are also lobbying institutions like World Bank to ensure that some of these loans are also targeted and reallocated for TB response in our country, because we have actually seen a drop, a very big drop in actually accessing TB services in the country. Government of Kenya should also adopt TB plans and interventions in a people-centered framework, and to actively collaborate with COVID-19 initiative, ensuring integration of TB services such as COVID-19 systems being leveraged for TB response, including laboratory infrastructure, diagnostic capacity, testing facilities, contact tracing mechanism, infection control procedures, prevention and awareness communication. It also includes scaling up digital health, virtual care initiatives tailored to the needs of people affected by TB. My last call to action would be for in-country partners, including parliamentarians, civil society, and technical partners, including USAID, to support national and community-led initiatives in response to COVID-19 by ensuring that TB is integrated and that digital health and virtual care initiatives are scaled up and tailored to the needs of people affected by TB. I want to leave it on that and just say that as CANCO, in collaboration with other partners, McGill, TB Center, Action, GCT, Kenya will also be launching the country report on 8th October. Please check our website or Twitter handle, CANCO KE, for more details on how you can participate in this launch. Thank you very much.
Thank you so much, Rahab. That was excellent. That was really, really good to hear how you've really actually gathered all the data and heard the information on the ground, found out what the real problems are, and taken them a step further with really concrete steps towards calls to actions toward the government, clear steps towards the funders. And this is a way of actually making change in the country. And well done for presenting. Really good to hear. Thank you, and we will definitely support everyone to come to the 8th October launch of the Kenya findings and listen to the details of your discussions in Kenya. Thank you. I would like to now introduce Kate O'Brien. Kate is a TB survivor and an active leader of the We Are TB group in the US. She is also a representative on many of the global institutions in the Union and the Stop TB Partnership as the community representative. I'm pleased to hear the story that she's going to tell about the US findings. We've seen in our report that everyone knows that COVID has impacted the US a lot, and it's going to be interesting to hear how the COVID has also impacted the TB situation in the US. So Kate, the floor is yours. If you want to share your screen, then we will look at your presentation. Thank you.
Okay, wonderful. Okay, so I'm sharing it now. You guys can let me know if something looks really crazy. Okay, so we sent our survey. We partnered kind of with the National Tuberculosis Controllers Association in the United States. So they helped us kind of disseminate and send out the survey. And we got a lot of responses from healthcare workers and people who work for TB programs. When we're talking about the United States, it's important to kind of remember that it's almost all done by like state government workers. When I got sick, I went to my normal hospital, but then I was reported to the New York Department of Health, and then they kind of took over. So I know when we talk a lot about TB globally, we talk about public versus private. That's not really how, it is so much in the United States. It's almost all like, state-run, government-run. So anyway, these frontline healthcare workers in the USA, we got about 74 responses from them. And I just really want you guys to highlight that they all said that about 71% less people are coming into the facility. People are scared. They're being told to stay home. They wanted to stay home. And this was in May, but I'm pretty sure that's still something that is the case. People are reluctant to seek care for a lot of reasons, for stigma, and also just because of fear of coronavirus. When we talked to people that were kind of the TB controller for their state, or the people that were kind of like the heads for TB in their state, we see really dire statistics here. We're seeing a lot of them were reassigned to coronavirus. Now, granted, this is an airborne infectious disease, and these guys are the experts, but it's not like they were asked to consult. They were like taken from their jobs and reassigned. And it's not like tuberculosis decided to like just go anywhere or be like, you know what, coronavirus, like you take this, I'm going to hang out for a while. Both of these diseases were happening concurrently, but instead all of the resources in the United States really seem to have gone to coronavirus, or at least a significant amount. We're seeing a reduction in services. We're seeing stockouts. We're seeing really dire statistics here from the reports from the United States. And it's really, really frightening. I'm mentioning the researchers, even though we didn't get that many, because you guys, I think that speaks to a lot of people that are probably watching. It's a very similar situation here where like funding and attention is all going to coronavirus. We know right now that like tuberculosis is using kind of antiquated ways of diagnostics and treatment, and how important research is. Since I've been involved doing tuberculosis advocacy, I still ask a lot of questions that no one really knows the answer to. We need research for this disease. It's incredibly important. And I also found this to be very, very sobering and very, very scary. So, you know, I'm going to include one of the things we did, because we got so many great results from the United States, is we made these cool one sheets that I think are beautiful. And I'm showing them to you guys because I want you to see some of the quotes. These are mostly from healthcare workers and TB program officers. So again, these are people that are on the front lines of both TB and coronavirus now. And so you can see that they're saying the one over to the right, they're spread thin beyond measure. They're the only available TB nurse to provide direct patient care for multiple health units and countries. In the United States, probably, I don't know if I want to say more or less than others, but I will say that like one of the things that comes up a lot is that people don't always speak the same language as the person that they're giving care to. And that can be difficult too. These programs are underfunded and they're just under supported to begin with. And now with resources being taken away to coronavirus, it's just a very dangerous situation, and it's a very stressful situation to work under. You can see that basically there's just a reduction in services, a reduction in resources of both people, of funds, of PPE, and of time. And we all know who will suffer. So here are some more quotes that you guys can see. And if anybody here is from the US and wants a copy of this, you can contact me or anybody on the team, and we can send it to you so you can do things with it. I find these kind of one sheets to be a really great tool when you're trying to explain a situation. People just don't feel like they're giving their patients their best work, and they're scrambling and they're working as hard as they possibly can, but it's a dire situation. So if you're watching this, I just wanted to quickly talk a little bit about some things that you can do. If you're watching this, I'm assuming that the audience is mostly people that are in Canada. So it's a little different than what we do with We Are TB, but maybe it's closer than you think, because like the United States, you're considered a high income country, and you might have the same situation where there's a lot of great tools to treat TB, but there's not a lot of great access, where the things are here, but only some people get them. Or the resources are there, but they don't get to everyone. And, you know, that's a problem. And that's something you can work on. So if you want to, you can always write an op-ed or a letter to the editor. It doesn't matter if it's in local papers or it's online. It's extremely helpful, and your representatives will see it. This Rubio one was one that we talk about a lot with TB advocacy, because it was a really well done op-ed, and it really targeted one of our representatives. And anyone can write one. You guys can write one. Anybody watching this can write one. Just use simple language, what you've seen, whether it's in your research or what you've seen from one of us. Why do you care, and what would help? I'm putting results on the spot here because David Bryden's really nice and always helps me with and We Are TB with ours, but also Robin's on the call, so I'm putting her on the spot as well. But you can also talk to like Friends of the Global Fund, TAG. There's a bunch of great organizations that want to help you as a researcher or as just a concerned individual write an op-ed. So you can reach out to us and we'll help you. And this is obviously someone in the United States, in Washington, D.C. This is Greg from We Are TB. But you guys have representatives too, and your constituents, and you have the right to talk to them no matter what your job is. So you can call them, you can look them up, you can ask to speak to the health aide, And I think for you guys it might be like health assistant, but same thing. And they're always super friendly. They always, they always respond. And when you call your representatives, it really does leave an impact, because a call takes time, and now nobody's really visiting their representatives. But later on, you don't have to go to Ottawa. You can go to your representative locally, and sometimes you might have to wait a while for the appointment, but you'll get it, and you'll really be able to make a good impact. So, especially, I'm catering this more towards Canada, but if I just really encourage you to talk to your representative. You can talk to them about what they're doing for COVID. Are they keeping international aid? Are they supporting PEPFAR, and are they supporting the Global Fund in their COVID packages? Are they supporting your local, whatever you guys have, the CDC, whatever your kind of version of that, your domestic programs? Are you guys being supported there? You can, look into that and ask your representatives. And so one thing I really want to touch on quickly, when I started doing advocacy, and I know that there's researchers on this call, I was really surprised when I talked to people that they hadn't met a TB survivor before. And I just want to throw that out there, that even in Canada, there's ways to connect with TB survivors and to include them in just your work and your advocacy. I think it'll help connect you to what you're doing. I think it'll help you with burnout. And I think it'll just make your work, your advocacy, your life, because we're awesome, better. And so I just want to throw that out there. I know that, I don't know if there's a We Are TB of Canada, but there should be. And I hope as soon as I found out what it is, I will link up with them. And you guys should find out what it is. And if there's not there, you should help it be made. And I want to say thank you. I want to thank you guys for your work. And I want to tell you that as people who are academics, researchers, we really need you. There's a lot of misinformation out there about all sorts of things, but especially about tuberculosis, especially about coronavirus. So your voice is incredibly important. And I want to tell you that I'm always here. Anybody will tell you, I love Twitter. You can find me there. You can find me on wearetb.com. And I will connect you to somebody and people that have helped me, people that have helped us advocate. Lizzie right there is in this picture if she's watching. Lizzie, thanks for all your help, and Tag's help. But there's so many great organizations that want to help you do this work. So reach out to us. And that's it. That's it from Kate O'Brien.
Thank you, Kate O'Brien. That was excellent and very energetic. Loved it. And devastating data at the same time. So with a smile, though. I would like to just open the floor right now. We have 4 more short presentations from different perspectives, but I would want to ask anyone if they have questions on the findings, either the global findings or the findings in Kenya or the findings in the US as are just presented. If you do have any questions, just raise your hand or take the floor right now. If not, I see that someone.
Delbert
yes.
here.
Please go ahead.
Hi, I had a question for the 3 groups who presented, and thank you, Kate, for presenting. I've seen you on Twitter, and it's great to meet you through Zoom. I think we've all learned that although COVID's been challenging, do you want to put on the camera? Sorry, I'm behind no camera, but trust me, I'm here. See if I'm here now. Okay. Although COVID's been challenging, it's actually taught us new things, like we can have big Zoom meetings with people we never did. In the hospital, we used to be told that we're not allowed to phone patients because it was bad medicine, and we found out that we were wasting a lot of patients' time by forcing them to come in and sit in waiting rooms for 3 hours and pay parking just to tell them their lab test was normal. So I think we can also look at COVID as an opportunity, and I'd like just to hear from the 3, because we risk saying there were the good old days of TB control from 2019, but that wasn't actually all that successful. So now we have an opportunity to reimagine the next days of TB control from TB elimination in 2021. What would each of you say is the single most exciting thing you've learned from COVID that you'd like to bring to TB?
Who wants to start?
I want to say money and resources and time and attention. That would be nice. But I think a lot of people in the United States are moving more towards, just like you mentioned, like video DOT, or like, you know, VDOT, whatever you want to say. And I do think that patients or people in TB care tend to prefer not having to go to a clinic or wait for someone to come to their home. I waited for someone to come to my home, but I know that in the United States, that's something that people tend to like when they're in treatment, because they can go about, it's a long treatment, and, you know, not having to wait for someone or have to stop by somewhere. It just really helps you go about your life. Like, I mean, I just really, you know, it's pretty self-explanatory, right? So I think that sometimes I know that there's a couple different brands that make VDOT, you know, applications. And I think sometimes the budgets weren't always there for them in the United States. And now I'm hoping that that is one thing that we'll really always find the money for.
Sorry, that's muted. Robin, go ahead. Do you want to say something?
Yeah, just really quickly, I'm feeling really inspired by how all of the big global health agencies have come together to co-convene the Access to COVID-19 Tools Accelerator, and the Global Fund is a part of that initiative. So to me, I feel like there's more scope and opportunity for delivering care in an integrated way rather than in our diseased siloed approaches, which actually doesn't do us much good in terms of using resources well. Yeah.
Thank you. This is Rahab.
Go
Just
ahead,
to
Rahab.
say that, yeah, just to say that one of the positive, there are many positives about management of COVID-19 in resource limited settings, is how COVID-19 suspects, patients, were able to be traced within a very short time and put in isolation. In a country where 40% of TB patients are missing within the system, that they are just in the community, I think that's one of the positive things that we need to do, that we need to make sure that if somebody comes and tests for positive for TB, we are able to trace them back to the community and bring them back to the health facility. People will think differently, but just to say that COVID-19 patients are being traced by the National Intelligence Services in Kenya, not to victimize them, but just to ensure that we are able to control the epidemic even at the community. And I think that's one of the positive things in terms of tracing and putting people in isolation. We also got to see, we have so many isolation centers for COVID-19, yet in Kenya, we have very few isolation facilities for TB patients. So we are even advocating that this isolation centers at the facilities, at the health facilities, be converted to TB isolation centers. Thank you.
Thank you all. I really appreciate those reflections.
E-cooling, yeah. Hello?
Go ahead.
Yes, I'm Hilmi from ZMQ Global. We are a technology for development social enterprise based out of newly set up in Montreal with our office in India. And we have been working in the space of TB with a model called active compliance and treatment strategy, which is actually patient driven and community driven. And we are right now working with patients and provisioning them remote control for adherence and treatment management, behavior change tools on their devices, and also remote connect for consultations in case of emergency. We are deploying this in one of the low resource districts in India, in Rwanda and in Uganda, and we would like to work in closely with partners here for research, different research components that we think are possible under the program that we are doing. We would welcome any suggestions from anyone who would wish to work with us. Thank you.
Thank you, Hilmi. I think this gives a really nice round of all kinds of aspects related to the opportunities that COVID has brought forward, where we really need to adapt the TB programs and the way we're doing TB care and TB prevention right now, whether it is from a telemedicine or kind of adapted models, as Hilmi was talking about, or the aspects that Raha brought forward. And I thank you for that question. That's a really important question. I would like to suggest that we have some short comments from some of the team members that really worked very hard on this report. We have specific perspectives from a human rights perspective that James Mallar is going to bring forward. He's a human rights lawyer working in the Stop TB partnership and working closely with the communities on the ground. He's going to just show us a few slides to highlight the human rights aspects, because that came forward as one of the key points out of our report. And I think it's important to highlight that. So if everyone has the patience to look at another presentation, which is short, I think I would really appreciate it. James, the floor is yours. Go ahead, James. We can't hear you yet.
There we go. Sorry about that. I was struggling to unmute, like I was having some technology challenges. But thanks so much, and I'll try to be brief with these comments. But I guess just to start, I really wanted to acknowledge the fantastic work of the team that was behind this. It was so fantastic to see. It was a community-led and civil society-driven initiative. And I think in some ways, reflecting on the question that was just put to the group, there was a lot that really came back for me and from a lot of the partners I've been working with as well around what are the things that we've learned. And one of the core things though is that TB, it really hits those who are the most vulnerable, those who are the voiceless, and those who have the least opportunity to influence decisions. And I think that with that in mind, this has been something that's hit home for broader communities now with COVID, is something where they feel so disempowered and so isolated and so uncertain. And that's something whereby we can really, really look to strengthen that people-centered perspective and rights-based perspective. And I think it's not so much about forcing compliance and adherence for TB going forward. It's about how do we create a really supportive environment where people are engaged and where people are informed, and thereby feel as supported as possible to go through what that challenging TB process is for them. So with that in mind, I think just to start, looking at the global TB framework, human rights are at its core, whether it's the NTB strategy, the paradigm shift, and the UN high-level meeting on TB's political declaration. Looking at that, there's one of the points on the screen talks about eliminating all forms of stigma and discrimination. And back to that, again, that question that was put to the floor, we've seen that stigma and discrimination has really exploded in the context of TB, in the context of COVID, I'm sorry, for both people affected by TB and people affected by COVID. And so we really understand how much of a barrier this is to effective and stronger TB responses. So when we talk about also human rights in TB, I think that it's getting more consistent and has a place here in the discussion. But in a lot of ways, it is quite superficial, and people will look at like the right to health without necessarily taking it further and understanding how to operationalize it at a country level and a grassroots level. And I think I just wanted to note, just to start immediately, to say that when we talk about the right to health, it does also include a right to life, a right to liberty, right to freedom of movement, rights to privacy, rights to confidentiality, rights to access to information, rights to freedom from discrimination, rights to accessing the benefits of scientific progress. So we cannot have a right to health if we don't have those other areas as well. And this is really critical when we're thinking about how do we design programs that are truly people-centered, which is something that I think we're all committed to doing. So I note straight away up front, like the modeling that's come out around TB and COVID that was done by Stop TB and a lot of other partners has said there could be an additional 1.4 million deaths and 6 million more people falling ill with TB. This at its heart is a human rights issue. People dying is a human rights issue, and the barriers that people are facing that are being exacerbated as a result of COVID are all human rights issues. Therefore, if we're going to have an effective TB response, human rights also needs to be at the heart of it. In particular, I note from the report and from some of the comments that have already been coming up, looking at interruptions of diagnosis and treatment and support, including things like counseling and nutritional support, looking at limitations in things like transport, and that was referenced earlier by a speaker, people's ability to access either their employment or as an alternative, access social security that is comprehensive. This is a huge barrier to an effective TB response as well. It was before COVID, and it has been exacerbated significantly since COVID. I think several speakers have talked about the existing inequalities and vulnerabilities being exacerbated under COVID. So this is placing people at additional risks, and it's limiting more and more people's ability to access the services they need. And as I already touched upon, increased stigma, discrimination, and marginalization is a massive challenge that the TB response is going to have to really be cognizant of and place at the center of its discussions. So my final slide is what can we do? And I appreciate the opportunity to sort of talk a little bit to human rights and really put this front and center. I think it's a really important time for us to reflect. And again, it's about the question that the gentleman put to the group before. Has our COVID response been something that's rights-based, gender responsive, and people-centered? And at the launch of the report for civil societies, the civil society report, we heard Peter Sands say, no, it hasn't been. And this has been one of the significant challenges in terms of our responses to COVID, and it has been an inhibition rather than a benefit. Second, the recovery plan that we're talking about, we know that it's in the works and a lot of people are involved, but there also needs to be, it needs to ensure that it is truly people-centered and rights-based and gender-sensitive. And we think about what that means in terms of operational realities on the ground and not just keywords that maybe are headings on documents. A third, community-led monitoring. Some of the information, and this survey itself is an expansion of this, has really showed us the value of information that comes from the grassroots, and we need to tap into that more, and we need to empower communities to be able to share that more. Fourth, understanding the barriers that people face in a more comprehensive way, whether they're social, whether they're legal, and understanding how COVID has exacerbated these barriers even further will be really critical. Social protection systems. I saw David's comment in the chat along with Robin's comments. We know that social protection systems have really been inadequate, and they've really cut at the heart of a lot of TB responses around economic support, nutritional support, mental health support, and we know that it has been disproportionately affected those who are already the most marginalized. The comment on frontline health workers and PPE has already been made, and then investing in TB affected communities is critical. We know, and we've seen already with some of the groups who have been involved in this survey, how far TB affected communities and civil society has come to really lead and dictate priorities in TB, and we need to see that we really take this momentum and go further forward. So final point, on my first slide, I had like a slide around the UN high-level meeting political declaration. And in that, we talk to accountability. I want to bring that conversation back here and say accountability is critical in terms of TB and responding to TB in light of COVID. And we need to make sure that we have mechanisms in place that don't see COVID as an excuse not to reach targets, but see it as an opportunity to change the way we do things, to be more effective, and to really give us the best chance possible to save all of those lives that have been predicted to potentially be lost and end TB by 2030. So thanks so much, and I hope I didn't go over time.
Thank you, James. That was excellent. It was great. Your slides were really clear, and it was really useful to hear the TB, the human rights perspective, actually, because it was such an important component that we heard, especially from the people affected by TB. There's so many aspects that came forward. So thank you for highlighting that. I would like to ask Weiswa Nkwanga, who works in the Results International with the Action TB Partnership, working together with 13 different partners around the world that are all civil society groups in different countries. And I would like him to just highlight a little bit the advocacy perspectives related to how the findings and the call to actions might move forward. Weiswa, do you want to say a few words?
Yeah, thanks, Petra. Yeah, just to say that actually a lot of things that comments we're going to make have been mentioned by two of our partners, Results U Canada, Robin, and also Rahab from Kenya. So those are part of the Action Partnership. And the way we are looking at this is an opportunity for us going forward to influence at different levels, governments and other actors in this space. We're looking at, as Rahab mentioned, really using the findings and recommendations of this report to drive national level conversations around how to adapt TB programs to COVID-19, and also how to implement the recovery plan going forward, using it to inform conversations around how to strengthen social support systems and protect human rights for people with TB. Driving conversation around at the upcoming Global Fund proposals, informing that process as well. We're using these findings. At the global level, we're looking at so many different moments. There's the G7 and the G20. Really using the findings and recommendations in this report to influence on that front, looking to, for partners in donor countries pushing their own governments, USAID and others, to really support the Global Fund COVID-19 recovery mechanism. Looking at other opportunities at the global level, including the upcoming board meeting of the Stop TB Partnership, as well as the Global Fund. There's also let me see, the Global Fund strategy development process, also using this report to inform that process, our engagement and involvement in that process. So that's how we are looking at things and as action. Yeah.
Thank you. That's great, Waiswa. I want to thank the audience. I realize that normally you might have a more research-based approach, talking more on the methods and more of the details of the academic background, to have the patience to actually swing how we in this group have taken the report and the findings forward to more of an advocacy approach. And one of the things that's actually really important when you have findings that are talking about a crucial situation on the ground, that there's action to follow up. And so a political commitment has been mentioned by almost everyone. And I would like to, I'm pleased that we have Cynthia Dantas, who works with the Global TB Caucus, which is a network of global parliamentarians. And she's been really instrumental in helping us think through some of the mechanisms of how to engage politicians in this whole, with our findings and our call to action. So Cynthia, if you would like to say a few things about the work with the Global TB Caucus, that would be great. Thank you.
Thank you, Petra. Can you hear me now? Okay, good. Thank you for the opportunity to share a little bit about the importance of engaging parliamentarians in the response to TB and COVID. I don't know if I should say anything else, because Kate has already so powerfully said so many things about the importance of engaging your representative, your elected representative, in advocating for stronger health systems. But I just wanted to tell you that we have a network of parliamentarians, which is called the Global TB Caucus, that exists exactly to do that. And it's a unique international network of 2,500 parliamentarians across the globe. And our value add is exactly that, the national work that we do. We try to focus a lot on the national advocacy in order to move change. And we do that through creating a platform where MPs, civil society representatives, academia, all relevant stakeholders talk and discuss the real need of TB in the country. So early in the breakout of the pandemic, the Global TB Caucus decided to conduct a survey with the MPs to help guide and direct where we should go with the pandemic. And you can see here on the screen, I'm not going to go through everything, but you can see on the screen that it was the responses were really different across implementing countries, donor countries, low burden and non-donor countries. But there was one thing that was very similar across all groups, was that we needed evidence to start taking action on TB. And then this survey that was launched provides exactly that. So with the evidence that we need, we can now take action. So in addition to the main findings that this report provides, it also has a take action, a calls to action. And it shows that it's no longer possible to wait. And parliamentarians have a key role to play, either in developing and implementing policies to ensure the continuation of TB services, and in implementing and developing social protection mechanisms through laws for the population affected by TB and COVID, and increasing healthcare resources. The parliamentarians are the ones who vote the budget, who approve the budget. So they have a key role in ensuring that the TB budget is protected and increased. And also supporting national and global fundraising efforts and supporting community-led integrated initiatives in the response to COVID and TB. So through that platform where civil society and affected communities are part and inform the MPs of the real needs, with that they can take action. And then we also make sure that we are also driving political will at the global level. Parliamentarians, they should use their voices to advocate for investments in health and push and press international organizations to do so. So the UN General Assembly, political groups like the G7, the G20, the BRICS, the European Union, the World Health Assembly, and push them to invest in health systems and universal health coverage, and a holistic response to health, ensuring that we build back better, as Robin mentioned, and actively include TB in the health frameworks. We've seen so many agreements and declarations for the COVID response and on pandemic preparedness. We need to ensure, and MPs are well placed to ensure that those declarations, those policies on COVID, they also include TB, and also investing in health, and investing in adaptations so that you know, COVID and TB responses can be integrated. And as Kate said, you can also engage your member of parliament. The Global TB Caucus is here to offer support. We have, as I mentioned, we have members in 150 countries, and there are 79 national caucus throughout the globe doing a heavy national advocacy for TB. And you can do that. You can help if your country already has a national caucus set up or a global health caucus set up, then you can share this. So we developed, as part of the advocacy tools, we developed for this survey, we developed a parliamentary briefing with the results of the survey, and that can be shared with the chair of the health committee, your national health caucus. You can engage other civil society partners and coordinate and ask for the national parliament. And if your country doesn't have a national caucus, you can help set it up. So you can reach out to us from the Global TB Caucus to offer any kind of support. The Secretariat is here to support on this issue. And I just wanted, I know that I've run out of time, so I just wanted to end with this part of the survey mentioning the importance of protecting investments for TB and how this should be reflected as a priority in the national budgets. And so that is how parliamentarians can help protect, and in grant and loans from relevant financial institutions, which is also something that parliamentarians from donor countries can help push. Thank you.
Thank you, Cynthia. That was a really eloquent way of showing us how the evidence goes into practice and how the political commitment is actually a really important piece. And the work with the network and 2,500 parliamentarians is really an impressive tool that we're lucky to have in our fight to end TB. So thank you for that presentation. Finally, I would like to introduce Austin Obifuna. He is the community delegation representative on the Stop TB board, the NGO representative, and he's a strong voice within the TB community on behalf of communities. I'm really happy to have him close off with some reflections on the report and on the findings in general. I just want to note that we also had Blessy Kumar from the Global Coalition of TB Activists and Timur Abdullayev, who is working with the TB people in the Ukraine as part of our group. I thank McGill really for allowing us to bring this whole group together and having the space for everyone to talk. But please, Austin, why don't you say a few words in conclusion?
Thank you, Petra. Let me start by just repeating what Rehab said in terms of how the communities felt a lot of challenges because of the COVID. But again, I think he also brought a lot of opportunities for us. Again, like work people who for us who work in TB, especially trying to look at other means of how to support our TB patients, and not just only trying to visit homes. But again, we've seen a lot of support coming from both digital approach so that we are now diversifying into other ways of doing things differently. But let me say that this research, this survey that we had, I see it as linking voices because it brought together different people from all walks of life, from different perspectives. We have researchers, we have advocates like me, we have parliamentarians who are also giving their support, and also people who are living with the, who had had TB before, survivors. So this is a very comprehensive, I'm not looking for any perfect approach to survey, but it's a very comprehensive survey that trying to highlight every aspect of TB challenges and our life and with COVID, and not just that. Also, it becomes, for me, this is a very strong advocacy piece for us to use to advocate within countries and also at the global level. I don't want to see this as a cookbook approach. I want to see it as something that we can implement. I want to see it as something that we can use as an evidence-based advocacy intervention. And for me, this links all the voices together. Having very strong global health leaders participating in the launch made it so beautiful for me. And coming from the community perspective, we've seen people from the grassroots speaking within the survey, telling us about the challenges they felt in their separate communities. We've seen people talk about nutrition, because we know that TB originally, TB is naturally a disease of the poor, as being said by being highlighted by WHO. But now it's no more the case. Anybody can get TB. TB can affect anybody. And in as much as in our continent, Africa, that it affects so many people, within the rural areas, it creates a lot of challenge, because even during the COVID situation and the lockdown, people ordinarily who are actually okay within their lives had challenges, even getting nutrition. Not to talk about people who are in the rural, who are challenged in terms of poverty, to the extent that most of them did not even have anything to rely upon. But we took the challenges to get to the people's houses through using the electronic system, being with them, speak with them, care for them as well, not even having the opportunity to visit them, but to visit them through these means. And it gave a lot of support. And the survey actually opened our eyes to so many things. And I hope that now that we are within the global fund processes, we can see them taking a lot of lessons from this survey and implementing it, having countries to also implement it. I like the presentation from Cynthia within the parliamentarians. I've actually started using the note for the parliamentarians. I spoke to the head of the Parliamentary TB Caucus for Ghana, and he's ready to read that in Parliament. He said this is a very powerful, strong advocacy tool for them, and which is really good for me. And he said it has a strong message to relate TB and COVID. And he said it's another advantage for them to speak more, to have more domestic finance within the country. Kate also highlighted a very important aspect for me, because obviously US is highly hit by COVID. And looking at, again, I wish your president safe recovery, because I just learned that he had COVID, President Trump. We have seen, very strong, in terms of how US was hit by the COVID situation, and we've seen challenges. And I'm happy that your organization, We Are TB, is helping to get people, link people to care, because that is the most important thing. It's not just about we putting our beautiful faces in the media, but also trying to make sure that we put people in the center of the disease. And this is what the survey has done. And for me, it was beautifully done, especially coming from the human rights aspect as well that James mentioned. I can strongly assure you that the Stop TB Partnership is taking real strong action around this. This will be highlighted a lot in our Stop TB board meeting that is coming up in November. And again, we have a section during the union conference that is forthcoming in this October. We have a section that will be using to also highlight some of the findings of this survey. And I will encourage you to participate. We'll be sharing that link soon. As soon as we have the link up, we'll share that. So let me use the opportunity to thank everyone who participated in this survey. The panelists, you are awesome. You did so well. Let me also use the opportunity to thank Maggie TB Center, Professor Maduka Pai. Thank you so much for giving us this platform to be able to share our findings. For me, I think we need to share it more and more, because the more we say, the more it internalized. People need to hear about it. People need to do something about it, not just sharing about it, but implement it. We need action. The call to action has to be implemented. So I want to use the opportunity to thank everyone, all the participants, Charity, everyone. So thank you so much. And let's meet again in Kenya. It's happening on October 8th. Well, I'll be there. And I guess all of you will be there as well. Thank you.
Thank you, Austin.
Thank you, Petra. Thank you, all the panelists, for a brilliant presentation and for brilliant work in bringing global attention to the disruptions that COVID has brought into our lives and onto the lives of TB patients. We have another short presentation from an undergraduate global scholar. So I crave your indulgence to wait another 15 minutes. And so I will be handing over to Faz to introduce her. Thank you for your patience.
Thanks, Charity. Thanks, everyone. And thanks for sticking around for another 10 or 12 minutes. So the presentation is by Marianne Sarufim, who's awarded a summer scholarship under the McGill Global Health Program's Global Health Scholar Initiative. And she's going to be talking about the impact of COVID-19 on TB care in Montreal, Canada.
Okay, hi everyone. Can I share my slides?
Go ahead.
So I'll be presenting the abstract that we're gonna send to the union on the impact of COVID-19 pandemic on latent and active tuberculosis treatment registrations in Montreal, Canada. So this retrospective study was occurred at the Montreal Chest Institute and was co-first authored with Coralie Géry. So a little bit of background about this study. So since the declaration of the pandemic in March 2020, we know that COVID has impacted a lot of patient care and operation of the primary care facilities all over the world. And we know that Canada is a low TB incidence country. However, certain groups continue to be at high risk of TB, like the foreign-born and individuals exposed to active TB. This study took place in Montreal, Quebec, and Montreal is the city with the highest number of COVID-19 cases and deaths in Canada. So the goal of this study was to assess the effect of COVID-19 on the number of individuals starting treatment of latent tuberculosis infection, LTBI, or active TB at the Montreal Chest Institute, which was a specialized TB referral center in Montreal. So we used a special electronic database called the MCI Tuberculosis Clinic eChart, in which all patients seen by our nurses to start LTBI or active TB treatment have been registered since November 26, 2005. And from this date to the dates of the database query, which was June 23, 2020, we assigned every registration date as either part of the COVID era or the pre-COVID era. And we classified the COVID era as every registration date that took place either during or after the Quebec government declared a public health emergency, which was the 11th week of 2020. And the pre-COVID era was classified as every date that took prior to the 11th week of 2020. After that, we classified for LTBI and active TB separately. We estimated the number of people per week being newly registered for treatment. Then we used Poisson regression to estimate the rate ratios comparing registrations per week in COVID era to pre-COVID era, adjusting for year and week of the year. So for the results for latent tuberculosis treatment, we have 6,849 patients being registered, and 6,801 of them occurred during the pre-COVID era, and 48 during the COVID era. Figure 1A shows the average number of LTBI treatment registrations per week in the pre-COVID era in blue and the COVID era in red. Poisson regression showed a rate ratio of 0.41 and a p-value below 0.001. And these results show that the number of patients starting LTBI treatment per week was 59% lower in the COVID era compared to pre-COVID era. And the results for active TB were a bit different. We had 902 patients being registered for active TB treatment, and 890 of them occurred during the pre-COVID era and 12 during the COVID era. Figure 1B shows the average number of active TB treatment registrations per week in the pre-COVID era in blue and the COVID era in red. And Poisson regression showed a 0.76 rate ratio and a p-value below 0.37. This means that the number of patients starting active TB treatment per week was 24% lower in the COVID era compared to the pre-COVID era. And while these results show that it's still keeping in variation from the past 15 years, it's still striking when you look just at the last two bars, so pre-COVID in blue in 2020 and 2020 COVID in red. You can see that the difference is still striking. So in conclusion, we saw for LTBI treatment a 59% reduction in the number of individuals starting treatment. And this is probably due to mandated reductions in outpatient clinical activities. For active TB, we saw a 24% decline. And while this is still keeping in variation from the past 15 years, it's still substantially lower when you compare it to pre-COVID era of 2020. These results show there's an urgent need to diminish the negative impact of COVID-19 in Montreal, especially considering since the second wave has started in Montreal and we're currently Montreal is a red zone. So I'm pretty much done. I just wanted to acknowledge all the people who worked on this study. My co-first author, Coralie Géric, who helped me a lot in translating the coding language and the statistical language. And from the Montreal Chess Institute, Dr. Sharon Mannix, Amélie Chabot-Fosso, Denis Francy, Octavien Boitard, and Jonathan Richard, who contributed to data analysis or collection. From the McGill International TB Center, Dr. Andrea Benedetti, who did the Poisson regression. And finally, my supervisor, Dr. Faz Ahmad Khan, who had, with his guidance and his support, this abstract presentation to the union was possible. Thank you. That's it.
Thanks very much, Marianne. Thanks everyone for sticking around. If there's any questions, you can jump in. If not, thanks very much.
Wonderful job, Marianne, and great job, Faz. Is this a temporary phenomenon, or do you think it kind of is catching back to the normal, or is it again dipping, or do you expect it to go by waves depending on the city's red zone or whatever?
So I'll jump in there. We're not sure. We have to look at the data again. I mean, a lot of this is mandated changes in patient care, and certainly probably also people deciding to access care or not. So it's something that we have to do, is just engage in ongoing monitoring to keep evaluating.
So presumably,
maybe Madhu, I could just add to that.
Yes, go ahead, Kevin.
Yeah, I mean, as the sort of head of the operation in some ways, you know, we were forced to basically completely close our outpatient clinics down, with the exception of, you know, major emergencies. I mean, I think, for example, somebody coming in with active TB symptoms would be considered, you know, an emergency, but almost all other, you know, and similarly for the other respiratory diseases, but almost all sort of non-emergency respiratory services basically shut down for, you know, a good 2 months or so, I think. So, you know, this has a huge impact, and I mean, evidently, now we're kind of dealing with how we continue operations during the second wave. So far, we intend to, and we are seeing, I guess, some patients with latent TB infection. But I think, I mean, Faz, you'll be able to say better, or Marianne, but probably still not as many as we would otherwise have seen. It would be interesting also to look at the profile. In other words, are we still seeing sort of contacts and not seeing as many people with less sort of strong indications for evaluation and treatment, or, you know, where are we still seeing reductions? I think that will be of interest as well. Thank you.
So presumably, delaying LTBI treatment may not be catastrophic by any measure, but active TB is something we simply cannot not treat. So is there any way to send them treatment at home, perhaps using outreach workers or some way of home delivery of medicine, or is the system does not allow that?
So it's not so much that they're not getting treatment, it's that the number of new individuals identified as newly having active TB has been reduced. I mean, once they're diagnosed, the actual treatment has not been a problem. It's the concern is that we're missing more cases now.
Yeah, do we have any more questions or reactions? I think we can take a couple more before we close out the session.
Question from Marcel here for Faz. Do you know, Faz, upstream of the clinic, how many referrals you got from immigration for post-landing surveillance, whether the referral to the clinic is down or rather whether it's people who have symptomatic disease who is down?
I don't have the number. My impression, though, is that the referrals were actually not down in that initial period. And the reason I say that is now we know our backlog currently is equal to the entire volume of patients that we usually see in a year.
Okay, thank you.
Any more questions or reactions?
Kate, do you know if the drop here in Montreal is reflective of what you're seeing in the US in terms of drop in notifications? Has the CDC reported its numbers?
To be honest, I don't know off the top of my head what they are like right now. But it was funny, as soon as you said that, that is exactly the same stat we got, like with the decrease in notifications. And I think in the United States, at least I can say that a lot of, the big concern in the United States is people that aren't being treated, aren't being found for latent tuberculosis or LTBI, so people, because if they're coughing, they're being pointed out, they're being brought in, but it's more their friends, their families, their contacts potentially getting, latent tuberculosis. And then when we have a situation where coronavirus hopefully is less of a concern, all of a sudden active cases go up. So I can find out for you, but I don't know off the top of my head.
Okay, I don't see any more questions, but if you still have, it's okay. We can still give one last. If someone has a reaction, we can take one last reaction to the panel and to the last presenter as well. Okay, if we don't have any, I want to thank again all our panelists for a brilliant, presentation and a brilliant work that, has set the global TB scene agog with discussions on Twitter and all over. We are really proud of the work that you're doing, and we hope that it translates to country level action where it's really needed, and that patients, TB patients that we all care about, have access at this time as well. To reiterate, I said at the beginning, we have our next seminar is on the 13th of November, and we'll be having Mayara and Mercedes talk to us about TB preventive therapy. And we also want to thank Madhu. He's handing over the directorship of the TB Center to Dick Menzies. Really want to thank you for your guidance and your awesome, directorship of the TB Center, and for also giving me a chance to work with you. We're really proud of all your accomplishments, and we wish that all your endeavors will be as brilliant and as productive as this one has been. Thank you so much. A round of applause for him, please. Thank you so much, Madhu, and thank you all for your patience and for allowing us to drag this out, by 30 minutes more. Thank you so much. Thank you so much to our panelists. We really love that you took the time to come speak with us today. Thank you, everyone.
Hi, everyone. Thank you.
Thanks. Bye.
Bye.
Thank you.